Hi, I'm Dr. Adatone Musa.
Hi, I'm Dr. Hussein Musa.
I'm a board-certified epilepsy specialist and neurologist.
I'm a board-certified pain doctor, addiction medicine specialist, and anesthesiologist.
This is Healing Talks with Kingdom Docs, and today we're going to address how direct care can fill the gaps in healthcare.
Now, direct care, for those of you who are unfamiliar, is a way that your physician can partner directly with you without any middlemen, without any barriers to healthcare. So you can work directly with a physician to improve your health. Now, in chronic pain, there are so many different reasons why patients have chronic pain. We all know about arthritis, we all know about back pain, but there's more complex syndromes like, for example, fibromyalgia. Now, fibromyalgia is a pain syndrome that is different in a lot of people, and there are certain criteria that you have to meet in order to be diagnosed with fibromyalgia. But all that means, if you're going to your primary care doctor and you have a diagnosis of fibromyalgia, oftentimes a 10-minute, 15-minute appointment won't really help you get to the bottom of it. And it's very frustrating for patients.
I can imagine. And with fibromyalgia, it's a pain disorder, but it also kind of crosses over with psychological disorders as well, right?
Yes. And for fibromyalgia, and that's just one example, the best treatment plan is a comprehensive treatment plan where you're working with the patient's psychological needs, you're working with medications, and you're also trying to address physical needs. There's specific areas that can be pain triggers and that can trigger your mind, and now you have widespread pain because you had one area that was more sensitized. And a lot of times, my favorite definition that I give patients for fibromyalgia is, you hurt, but we don't know why. So we call it fibromyalgia.
Wow. I wonder, in this patient population, is it also important to look into other causes of their pain just to make sure that, it's not fibromyalgia?
It's interesting that you say that. So fibromyalgia is a diagnosis of exclusion, meaning that your physician or team of physicians have to take the time to do the test to rule out every other possible cause of this type of widespread pain syndrome.
Yeah.
And as you can imagine, in our current healthcare system, it's very difficult for your primary care doctor to go through all the studies to even know which studies to target. So a lot of times these patients are referred to different specialists after specialists after specialists, and there's a lot of time in between these appointments. And you may take you 3 to 4 months to see your psychiatrist, 3 months to see your pain doctor, 3 months to see your neurologist, 3 months to see your sleep specialist, because sleep disorders is highly correlated with dysfunction and fibromyalgia. All that to say is that you have a patient who is suffering, and all this time they're going from doctor to doctor, and they may not be getting the in-depth care that they need. And in a direct care practice such as ours, you would have the ability to see your doctor frequently. We won't have as large a patient panel, and more importantly, you can talk to your doctor. One of the most frustrating things that I've seen from patients, and I understand, is that when they're prescribed a new medication, they take it and it doesn't work. And then they're calling the doctor's office saying, "Doctor, this new medication doesn't work." Well, it's going to be about 2 to 3 months before I can see you again. And hopefully, if you get in contact with the right team member, the right staff member, or even the physician themselves, they'll be able to titrate the medication over the phone. But a lot of times that just doesn't happen. So now you start a new medication, the patient no longer wants to take it. They may never have been on the appropriate dose, but now they've lost trust in your system, they lost trust in your treatment plan, and simply because they couldn't have access to you.
It sounds like a lot of inadequate trials, a lot of starts and stops. Yeah.
Yes, it can be very frustrating, but I think direct care can be a great solution to that problem for patients with chronic pain who need that in-depth care and that frequent treatment.
Absolutely. Well, that covers this episode. Please join us next time on Healing Talks with Kingdom Docs.
Thank you, and God bless.